Good morning. My name is Mark Baldassare, and I'm the President and CEO of the Public Policy Institute of California. Thank you for joining us today. PPIC is very pleased to present this virtual program featuring Dr. Michael Drake, the President of the University of California. This event is part of the Sutton Family Speaker Series. I'd like to thank Tom and Marilyn Sutton and their family for supporting this annual series. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. If you have a question for President Drake, you can send an email, ppiceventquestions@gmail.com. Please include your name and organization. And we have some time at the end of the program for these questions. Now, I would like to welcome our featured speaker, University of California President Michael Drake. President Drake, thank you so much for joining us today.
Very nice to be here today. Good to see you.
So let's start. I haven't talked to you since the middle of October when we got together virtually a few months after you became UC president. So I'd like to check in with you and find out what are your priorities as you think about this leadership role at this changing time.
Well, thank you. You know, our university is very large. We are 220,000 faculty and staff and about 280,000 students. So that's a 500,000 people. And as such a large organization, our priorities are often the priorities of our state, of our nation. So we've been, of course, very focused in the moment on COVID and the COVID crisis and how it's affected both our work on our campuses and with our students, but also how it's affected our communities, the families of the people who work with us and who come to visit us every day, and our entire enterprise. So that's been a real focus every day, obviously, in some measure, to move through this year of crisis and to move on to a better future. We also, though, while doing that, want to make sure that we stay focused on the issues that are the most important ones for our university broadly, and that is to really do all we can for access, affordability, and excellence, to balance those areas of focus for us is really an important part of what we do. And so we want to be the best university we can be in so many ways. And part of that is teaching our students. The other part of that is continuing our research mission. Another big part of that is reflected in COVID is to do our health sciences and health services mission, to treat people today and to find cures for diseases tomorrow. And then really through our research mission to look at answering the questions that perplex us. So it's been all those normal things that we do at the university, plus the overlay of the COVID pandemic.
Yeah. Thank you, and I look forward to talking with you about your thoughts about the COVID pandemic. I think that one issue right now that's on everyone's minds in California involves the reopening of campuses and schools in general. But if we can talk in this case about what are the big issues facing UC in reopening campuses.
Well, our campuses now are open in one way. So if we think about it, roughly half of our enterprise, plus or minus, is in the health sciences. And so our health sciences education has continued, and obviously our hospitals have been working. And, I don't want to go through any discussion without mentioning the incredible work over this now fully a year that our healthcare workers have been there on the front lines, taking care of people and doing what they could to save lives and to help us all as a country learn better how to deal with this. So that work has been going on all along. And then in addition to those people who are really the frontline healthcare providers, we also have the support staff there. We've had people working in food service and transportation and security and other things that have been there. So 65% of our staff has been working throughout this crisis on a daily basis. So we've always been open. And then our faculty made an incredible pivot from work that they'd been doing in many cases, 20, 30, 40 years. Some of our faculty had been teaching in a certain way. And we had this pivot in the spring to go from in-person to virtual instruction, to online instruction. And they did that remarkably well. Our students had to change many times where they were living, but also how they were learning. And I would say that the faculty and students really have supported each other in making this change together so that our students could continue to make progress through their education and on to their degrees. There are many times when that hasn't been exactly as we'd want it to be. We've lost a lot of the robustness of being there together, but there are actually some things in the virtual world that we've learned to do better virtually than we were doing them before. And so we will hope to take those lessons and improvements and move forward. So all those things have kept us moving is I guess the first part of my answer. The second part is what will look like, let's say, in the fall of 2021. And our expectation now, our plan now is to be back with most instruction taking place in person in the fall of 21. What exactly that will look like will be determined by the behavior of the country and the virus over these next few months, but we're hoping to have that to be able to get classes back together in a modified fashion, but have in-person instruction be the main way that we deal with instruction in the fall. We expect to have our dorms back with students living in the dorms. The capacity, I'm sure, will be less than it had been in the past, but still robust capacity. And even during this time, I mean, our campuses we're all together, but independent. And so the campuses have had different approaches to how they would work during this time. Sometimes depending on the rules of the county health departments, but other times campus leadership. The San Diego campus has had the greatest number of students on campus, and there are 10,000 students or so on the San Diego campus today, and have been throughout this. And so we're looking to bring people back in large number by the fall. So that's the hope.
Thank you. Thanks. So you mentioned that there are things that you feel we're doing better now as a result of what we've learned. And I'd like to dwell on that a little bit and also ask you if there will be a new normal as a result, or next normal as a result of the pandemic, or do you see things going back to what they were, let's say, a year ago before any of this really got to the serious point where it is today?
Yeah, I don't think that the fall of 2021 is going to look like the fall of 2019. Mm-hmm. I think it will look more like the fall of 2019 than the fall of 2020, but I don't know that we'll ever be back, certainly not in the short term, to where we were 2 years ago. I think we'll be much more thoughtful about the way that we protect ourselves when someone's not feeling well. Mm-hmm. The whole series of other things will be true. And part of our returning to the fall and what that new normal will look like will depend on a continued effective rollout of the vaccines and how widely the vaccines are distributed. And then we'll learn more about vaccine over time, but how effective it is for over the long term for people in congregate living circumstances. So those things are things that we're learning day by day, and we'll continue to follow that. One of the big changes, though, as I mentioned, we've gone to virtual learning and gone to online meetings like the meeting that you and I are having now. And so I think two things will be very different. One is that our education, even our in-person classes, will have a higher fraction of the course content and the communication take place in a virtual way. And I think that's an improvement. We've seen that in another part of our enterprise in telemedicine. A year ago today, in February of 2020, we would have done a few hundred telemedicine visits in a month. Now we're doing 50,000 a week. And I don't know that we will, it was higher than that, over the summer when we were not doing many in-person visits. Now we've brought back our in-person visits to nearly what they were before, but added to that about 50,000 telemedicine visits a week across the system. And so I'm sure that telemedicine presence will continue. And what that improves is a variety of things. First, it's much more efficient for many of our visits. We've all been patients, and you have to get in the car, go to the doctor's office, park, ride up, wait in the waiting room, come in. and all of that can be quite time consuming, can take many times longer than the time you spend with the provider. And now with telemedicine, many visits can be done with just you from home or your office, wherever you are, and the provider working together. So we think that kind of an improvement will be a big part of what we continue as we move forward.
Thank you. Well, I'm certainly knowledgeable about your background in medicine, and I would like to just take this opportunity to give our audience a chance to hear from you about where you think we are in terms of the pandemic today, and how you see the rest of the year. Yes.
Well, first, I'm encouraged that the last month, since we all knew that there would be a fall surge. That's the history of pandemics of this type, is there's a surge in the fall and winter months. It really, I had hoped it would look like a hill that we'd have to, but it was really like Mount Everest. I mean, it was incredibly vertical, nearly as we move vertically, incredibly steep. The expectation was a surge through the New Year's holiday, and then a plateau a few weeks into January, and then a fall off coming down the backside of that mountain, essentially. And if we look at the charts and the graphs now, that's what it looks like. Like, we did have that surge in the fall. It was higher and steeper than we had hoped, and in many cases even than we had feared. And many more people were lost their lives, and it was a real impact on the country and the world. But it appears to have peaked and flattened out a bit, and now it's coming down. So there's been, as we all have seen, a relatively rapid and steady drop off since the middle of January. My certainly hope is that continues. A couple of things would help us to believe that it should continue. First, the dangerous mass migration and super spreader events that happen when people come together over holidays. We don't have that kind of a threat facing us in the near-term future. So that's a good thing. Second, I don't know how widely this is, and you're more on data from polls and things, but I'm hoping that that the number of people in the population who don't get how dangerous this is vanishing. That there are not many people still out there who think that this is something they don't have to worry about, or it's not so bad. So I hope that number is shrinking, and that the vaccines have begun to roll out. And we've seen in our own small anecdotal sample sizes of how the vaccines have affected the infection rates among those people working in our hospitals. But also I've read studies from Israel where the relatively large groups of patients in the health plans have been compared, a couple 100,000 vaccinated and a few 100,000 not vaccinated in the same health plan. And the rate of infection in the vaccinated groups is dramatically lower than in the unvaccinated group, mimicking the results that we saw in the clinical trials. And so that will also help to continue to push the number of infected people down and keep us going on that right slope. So let's say that continues. If that continues, and we're able to continue now, we're at about 1.7 vaccine doses a day being distributed. And that I will hope will grow actually as the Johnson & Johnson vaccine, the one dose non-cold chain Johnson & Johnson vaccine becomes available. So if we keep this rate or a higher rate of vaccines moving forward throughout the rest of the winter and into the spring, by the summer, the predictions would be that this would be largely controlled. And so that's what I'm looking forward to. When it's controlled, though, we still will need to practice non-pharmaceutical interventions and still be careful with our masks and social distancing until the virus is largely gone. It will still be with us, but I think suppressed and relatively rare by the summer. And until we get everyone vaccinated, until it really goes away, we're all going to have to continue to be careful. But careful behavior, the widespread adoption of the vaccines, looks like things will be much better during the summer. Let me say one more thing. No, I didn't mention this. In our own, the part of our community that has been vaccinated so far have been the healthcare workers.
Mhm.
And we found that those healthcare workers have been overwhelmingly accepting of the vaccine. Some deferred for one reason or another, but the overwhelming majority have accepted the vaccine, and that's gone well. And we have patients, more patients are seeking the vaccine than we have vaccine for. And so we're doing that, vaccinating at this very moment and as fast as we can. There's some fraction of the population that's reluctant to receive vaccines.
Mhm.
That fraction of the population then creates a safe harbor for the virus. And the larger that fraction is, the safer place that the virus has to reside and to multiply, the more difficult it is for us to get on the other side of this. And those are things we'll have to see as we move forward.
Yeah, and based on our recent polling, that fraction seems to have declined since the fall, and it's something we'll keep monitoring here at PPIC.
Can I say one thing about that? Just you're monitoring PPIC. It's one bit of data I saw last week. I looked at the 4 drugs that are available and being have gone through phase 3 clinical trials. That the 2 that we're using now, the Johnson & Johnson and the AstraZeneca, in different parts of the world. And in all of those studies, there are about 20,000 patients in the treatment arm, about 20,000 patients in the placebo arm. And the protection range for between, in some cases, 70, 75% up to 90, 95%, the protection against getting infected.
Mhm.
But even more than that, when you looked at the 80,000 patients who were treated in those 2 treatment arms, and there's a 5th drug also, you looked at the patients in the treatment arms. What you found is that if you looked at the number of patients hospitalized for COVID in the treatment arms, it was actually 0 across the entire realm. So there were some infections, but they tended to be relatively mild. Number of patients who had severe disease after being vaccinated was 0 in those studies. Number of patients who died from COVID after being vaccinated was 0 in those studies. The number of patients who died from the vaccine, had a fatal reaction from the vaccine, was 0 in those studies. So what we found was that the effectiveness of the vaccines, no matter which one it was, against severe disease and death, they were completely effective, and the vaccines didn't cause a fatal reaction in anyone. So those parameters across those 80,000 people, or a few more than 80,000 who were tested in the trials, showed the vaccines to be quite effective against the severe impacts of COVID, and to be safe in the ultimate way. And now we have, I haven't kept up to date today, but 50, 60,000 doses administered across the country with good safety and so quite good effectiveness. So I'm hoping as people see this, that those citizens who are reluctant understand that it protects them, protects their families, protects their communities, protects the country, and hope that people come along and do their bit and get vaccinated.
Thank you. And I'm glad that I asked you, and I feel like the governor maybe should be using you in his public health message because of your great knowledge of this area and your ability to articulate on the importance of vaccines. When we look at the economic impact of the pandemic, clearly it's falling disproportionately on lower income households, communities of color, and women. Groups in which there were disparities to begin with, but now we're seeing those disparities throughout the pandemic in terms of who gets ill, who's unemployed, who dies, and when we think about all these things, I'm wondering about how you think about the University of California in terms of both promoting economic opportunity and also making sure that we have an equitable and sustainable recovery.
Yes, this has been a stark kind of clear, I don't want to say realization, but a refocus on this thing that we see all the time, and that is that the social inequities that we have in the country manifest themselves in so many ways, large and small, every day. Mm-hmm. So that the COVID crisis, climate crisis, all of the things that really affect us as a country affect those who are most vulnerable the most. That these were the people most likely to lose their jobs and the people most unlikely to have the resources to be able to go without work. And all of the things that we would look at were worse for these populations. And so we, as a university, want to continually focus on this and to do our best to help narrow those gaps. But it's an ongoing challenge for all of us, and it's something that we've really tried to focus great attention on. One of the ways that we approach this is through one of the things that we monitor is our own diversity and who comes into the university and how people in the university are supported. And at least recently, we supported something called Prop 16 that didn't pass. But even with that not passing, we had the most diverse class in our history admitted this past fall. So we believe that our access, never enough, and always we always want to do more. But it was the most diverse class that we've had this fall. We do our best to provide economic opportunity, in that 57% of our students at the University of California actually through grants don't pay tuition. So that's something that's I guess not widely known, but about 57% of our students have their tuition covered entirely by grants, and so that's something that we think helps in providing opportunity for students. We have a large number of students applying for admission for the fall of 2022, and we were pleased to see that African American applicants were up by about 20%, and Latino applicants were up by about 11%. Actually, transfer applicants from the community colleges were up about 5 or 6%. So we're seeing that the attractiveness of the university is clear to many people across our state that are representing groups that have traditionally been underrepresented in the past, and we're very interested in continuing that attractiveness. And then we're interested in each of our campuses. There are different programs at different campuses, but each of our campuses have myriad programs to do what we can to help people who come to the university then be successful at the university and graduate on time and to get those degrees and go out there in the world. And so it's an ongoing effort for us. Actually, something I've been involved in many ways for 30 or 40 years, is to try to do what we could to continue to support access, continue to support affordability, and then continue to make the university the excellent place that makes access and affordability of high value.
Thank you. And I appreciate the fact that we've, discussed some of the issues around diversity and inclusiveness at UC and the priority it has under your leadership today, and specifically around students. And I'd also be interested in anything you might have to say about other aspects of UC life. In particular, the issue of faculty recruitment, and also more recently, within the last year, issues around policing. So, any thoughts you have about campus policing?
Great. Well, a couple things there. One of the things I was mentioning, access, and I mentioned that 57% of our students are able to attend with grants, Pell Grants, and other levels of support. Cal Grants, Pell Grants are able to neutralize the cost of tuition, which is very important. We also support doubling the Pell, and so we are very supportive of the federal efforts to increase the Pell, which has lagged behind over these last many years. About 40% of our students now are the first in their family to go to college, and the first to earn a 4-year degree, and so we're very, very interested in making sure to support those first generation students, and we think that's always a great step forward. We have among the programs, we have ones that I know well from my former time at the university, is a program called PRIME, that's Programs in Medical Education. And these are programs that were started for the purpose of making sure that we had an enhanced pathway from the entry of medical school to practice in underserved communities, or to a practice that focused on the issues of underserved patients. And the programs started, the first one started in 2004, to now programs on 6 of the medical campuses and growing. And in fact, I'm very pleased that the governor's budget had an enhancement of permanent funding to expand these programs even more. And the idea there is really to train for the university to train people to be able to be in communities and to be able to be available to patients to really meet those the gaps in care that our system had developed over all of so many years. Not the university system, but really the American system of healthcare. We wanted to make that more equitable. So we're pleased about that. And so there are lots of things we have that are moving forward. There are other areas that are we're continuing to work on. One of our continual efforts, and was an effort when I joined the faculty many years ago, was to diversify our faculty. So I've mentioned things that the outreach and all that we've been able to do to help bring students into our campuses, the programs we have for undergraduate and graduate students to be trained, and efforts to diversify it there. We have a continual effort to diversify the faculty, and it's better than it was. I noticed that. That's a great thing, but it's something we have to work on day by day, and so that's a focus for us. And there are many ways we do that. One is by training our own graduate students. And we appreciate that, and then try to keep those graduate students. We also recruit graduate students from other places across the country. And one of the things that I worked on for years was a Hbcu Collaborative, which is an initiative that really tries to make sure that we're connected with students from diverse backgrounds across the country who can then come and join to be trained here or to join our faculty. So very, very important thing. So that's a big and a constant effort. I'd say I have a conversation on that topic or on that particular subject half a dozen times a week, every week. So it's an ongoing effort that we and many of our colleagues in higher education continue to work on. And again, we want to always do better there. Finally, you mentioned another issue that's a huge issue. Which is the campus safety and security, and how we can enhance that and make it better. And we're in that realm. We have this moment in history now, I think, where there's heightened focus on the inequalities that you mentioned. And again, COVID sort of laid those things bare. It really made it stark every day in so many ways. And one of the things that we all have seen again and again over the years is the way that people of color, Black men in particular, are treated, have been treated by the police, and the horrific assaults that we've seen so many times. But I would say that I have remembered them since I was a child. Though this wasn't something that just happened at Ferguson or just happened with Rodney King, or it was the norm all the way back. And then through so many things that have been challenges to us, stop and frisk, the fact that a person of color could just be expected to be pulled aside and stopped and accosted and treated as though he or she were a criminal. And the percentage of finding something that made it the stop a worthwhile stop was minuscule, but the insult and the disruption were there on a daily basis. And then with Rodney King and Breonna Taylor and others this last year, the country has Ahmaud Arbery, so many. The country has seen this over and over again, and so we raised the awareness of this problem to a new level. The challenge is then actually doing something about this that changes the way that we behave in the future. We on our campuses then have begun this in the fall, each campus having a series of discussions with their local community, not sort of pointed in a direction but not guided. And then the campuses report back to us when we come together and hear from them. We had an assembly 2.5 weeks or so ago where we brought some national leaders. People have had different experiences together to enhance that conversation, but that conversation on a system-wide level continues. We're going to be coming together again in a little over a month, and then we'll look for a report that comes later this spring, and then some guidelines by this summer. And the goal is to do this. First, we don't want to do anything that makes our campuses less safe. We think the campuses have to be safe places for you to live and to study and to work, and so that's very important. But we believe the campuses can be even more respectful of all. And so we want to really do everything we can to make sure that everyone on the campus is treated with full respect in their daily lives, and there's no reason to expect to be treated in any other way. What we find is, a long topic, but what we find is that people arrive on campus with the accumulated experience of their lives in the world.
Sure.
And no matter how we treat them on campus or how campus, the campus security forces work to interact with them, people arrive from different places and with different experiences. And the problems that we've seen overwhelmingly are problems that occur with city police and state police and others, are things that occur off campus, but we bring those experiences with us to the campus. And we want to do everything we can to make sure that everyone on campus is treated appropriately. I will say one more thing. When we look at how we do it now and what we think we're going to do in the future, we have there's no predetermined outcome. So we're not tuning or adjusting or whatever. We are, everything is on the table for the way that we move forward. And as we are receiving input from a wide range of opinions and experiences across the campuses and across our communities, we're going to do our very best to absorb all of that input and then create the safest, most respectful, most supportive campus environment that we can, however that looks. I'm sure it will look different, but however that looks. And our goal is to get to that point with everyone's cooperation and engagement. And sleeves rolled up. It's a big task. We're sleeves rolled up. Let's do our best on that.
Thank you, and appreciate hearing your vision on how UC can help lead California and the nation in advancing racial equality. Another big issue of our times, of course, is climate change. And I'd like to hear your thoughts about how UC can help lead California and the nation on climate change.
Well, I appreciate, our goal is to be the best practitioners that we can of the things that we believe in, to try to be good examples and to learn by that. And then as we can do that, share those best practices, share what we've learned, share those places where we fall short, share those places where we succeed with others, either through research or in symposia, whatever, so that we can help to lead the discussion and the enterprise forward. So for climate change, we, for years, have been working on a variety of things, greener buildings. Our building I'm in now is a LEED certified building, and we try to do what we can to do be good partners in that way, to try to use less energy ourselves, use cleaner energy ourselves. I drive a plug-in electric hybrid. I have been for years on purpose for that, and so we want to try to do those kinds of things. But we also then want to learn from the great climate science, from the great scientists that we have across the system. And then as we learn from that science and get those data, we want to use our people like yourself and others who are in the policy world to say, gosh, how can we take what we've learned and turn that into policy that will actually make a difference? So we have a goal of being net neutral, carbon neutrality by 2025, and we're pushing forward with that. We want to continue. That's not that's a milestone. It's not an endpoint. We want to continue to be as sustainable and environmentally responsible as we can moving forward. And so it's a daily effort for us as consumers, users, people who live in a community, but also as scientists, as educators, as policymakers. And we're very pleased about the university-wide collaboration, and actually collaborations we have through UC3 and other things with other universities to try to push this dialogue forward and do what we can to save the planet. The time for urgency was yesterday, and we're full speed ahead.
Thank you. I appreciate that. As we at PPIC think about the big challenges facing us now, and I've been thinking about this even more so after January 6th, the political divide that we have in our country, and where we're going as a society in terms of the abilities to deal with some of the big differences that have surfaced in terms of views of facts and knowledge and the right path forward. And I just would like to hear your thoughts in terms of what the University of California's role is. I think about this all the time for PPIC, about what we can do to help bridge the political divide.
Yeah, I think we've all watched, I don't know, to speak of me, but all really in horror as over these last years. And the thing I guess that was most unsettling for me was the assault on the truth, that you could create facts and create a narrative that really was not true, completely debunked, and still got a foothold. And I mean, I had a career as a research scientist, and so the deal was you would ask questions and go and try and find out the facts, and then be informed by what you learned, and try and modify your behavior appropriately. And the idea that you could decide what you want the answer to be and then make up facts to support it, I just found horrific. We try to be a place that attracts people. As I mentioned, you mentioned some contentious issues that we're facing these days, and we try to be a place that brings people to an enterprise that allows them to engage, to share their experiences, to share what they've learned, to listen to and engage with others, and to use that to grow forward together. And it's been a model that we've enjoyed and has been very successful for our university, but for the nation and the world for all of these centuries. And we want to continue to be that place where it's a place that's safe to have an opinion and safe to voice that opinion. And then, but it's also encouraged that you will listen and listen to and respect the opinions of others and move forward. We don't always agree. I mean, the thing that is the rich culture of the campus is that people don't always agree. When it's done right, though, you're able to disagree in a respectful fashion and to learn something from the person who has a different point of view. And we will continually try to model being a safe and effective place for people to come and to live and learn and to grow.
Thank you. I appreciate that. I have a broader question about education for you, and I want to frame it in terms of your own biography. So you graduated from McClatchy High School in Sacramento. You got your undergraduate degree at Stanford. You got your medical degree at UCSF. So when you think about how well the California education system is working today now for children growing up in California, how do you think about how our education system is working today?
Yeah. So a couple things. You said something else I want to reflect on a moment too. But so, when I grew up, we had a really strong public K through 12 education system. I was public K through 12 education system. The nature of the baby boomer generation was that we were squeezed a bit. So I finished high school early. I went to community college, which was newly opened up with the master plan. It was a great and encouraging thing, and then transferred and was able to pick places to transfer to, and then go from there to the rest of the education you mentioned. And so I felt well supported in that, and well supported at the beginning by effective K through 12. And I know that there were changes then really in the 70s and 80s, and the K through 12 support went from among the best in the country to not being as strong. And I think that's still an area where the state has to continue to focus. I know that I have children and now grandchildren. Actually, I have grandchildren who are in public, kindergarten and third grade here in California. And they actually are supported by dedicated teachers and people working really, really hard. But it's really an area for our society broadly to focus on, to make sure to focus on K through 12. And then I'm pleased in the master plan, there are the three segments: the University of California, the California State University system, and the California community colleges. And I have good colleagues in Chancellor Joe Castro and Chancellor Eloy Oakley. And we all work together. We see each other every week or two, virtually like this, but every week or two we're together. And we're, I think, all three committed to doing our best to make sure that the articulations between our segments are even better than they've been. We have among ourselves been to multiple units and transferred and everything. Just the three of us, when we talk, we've had these experiences. So when we say that we want to make sure that's a robust and straightforward pathway, we say that from experience and from our own life history. So I'm optimistic about our ability to work together, and pleased to have such great colleagues and long-term colleagues to be able to work on these things. But I think it's an ongoing focus of our society to make sure that we are doing those things to help all of us have a pathway to education and to a brighter future.
Thank you. And it's encouraging to hear that you talk often with Chancellor Oakley and Chancellor Castro, and actually next week we'll be talking to Chancellor Castro and Chancellor Oakley. We've talked to many times in the past. I appreciate the values you laid out about access, affordability, and access, affordability.
Yeah, I said access, affordability, and excellence. I said, right, we want to make sure.
That excellence, one of our values.
Three-legged stool, yes.
And I want to come back to that now. And as a public university, you need to strike the balance between financial stability and keeping college affordable. So I think that one question that you must get asked a lot, and so I will ask it, is are there plans for UC tuition increases?
Yeah, I'll say that so we say access, affordability, and excellence. We've had no tuition increases in, I think, 10 out of the last 11 years. And we're having no tuition increase this time. It's totally inappropriate to do such during a pandemic, we felt, and when education was so disrupted.
Yeah.
Is that a permanently sustainable circumstance? I don't know that I can't see how that's permanently sustainable. But for the time being, what we're doing is honestly working on doing everything we can to make college more affordable. And even then, just as I mentioned before, 57% of our students today don't pay tuition, and there's no plan to lower that percentage going forward. So certainly for in this case, the majority of the California students who attend the University of California, where the tuition currently is effective tuition is zero, there's no concept that that's going to change in the foreseeable future.
Thank you. So I was reading about your work when you were at the Ohio State University. I wasn't as much in touch with that part of your career as I was with earlier aspects, but I was intrigued by the fact that listed among your efforts was the Ohio State Tuition Guarantee and the Ohio State Land Grant Opportunity Scholarships. And I was wondering if, either of those initiatives were things that you were thinking about bringing back and to the UC system, or something else that might deal with, access, affordability, and maintaining excellence along those philanthropic lines.
Yeah, I mean, when I'd been here for many years, been at the University of California for many years when I went to the Ohio State University, and I kind of took the things that I'd learned here, there, and found there were some places where things that we had done might be useful there. So one of the things we had was a thing called the Buckeye Opportunity Program, which meant that we pulled campus resources and other together so that we neutralized the cost of tuition for Pell students. And that hadn't been done before at public universities in Ohio. We did it on our campus, and we meant that we took the effective tuition down to zero. That was very important for us. That had been done already here in California, and so that was taking something there that helped. We also then pulled together resources for scholarships and the land grant opportunity scholarship. All the states are different. Ohio has 88 counties, and so there was a scholarship program for someone from each of Ohio's 88 counties to be able to have a full ride scholarship to the university. We actually raised the amount of that scholarship and then doubled it, so there were 2 per county. So that was 175 students a year who had their college covered fully. That was we felt very good about that. It let students know, no matter what their zip code, that there was an opportunity there for them. And then we did a whole series of other things. And the thrust of all of them together was that I should say, we decreased the time to degree, we increased graduation rates, we narrowed the achievement gap, we increased diversity, we decreased the fraction of students that graduated with debt. And for those students who graduated with debt, we lowered the amount of debt they graduated with. I mentioned we increased diversity. We also increased the number of Pell students that we had. So when I say we decreased the number of students who graduated with no debt, and we decreased the debt of those students who graduated with debt, we did that at the same time that we increased the number of students who came from low and moderate income backgrounds. So all those things were done together to make the university more accessible, and it was more accessible, largest classes, the most diverse classes ever by a margin. More affordable, less debt for those who had debt, and more students with graduating with no debt, which we thought was very important. And then for excellence, the graduation rates improved. The four-year graduation rate improved 18%. On another measure of excellence, we doubled NIH funding during that same period. We increased the number of faculty awards. The university had 5 Rhodes Scholars over the 100 years before we arrived. They've had 4 Rhodes Scholars in the last 5 years. So we found that excellence and the measures of excellence were increasing at the same time that we increased access and diversity, at the same time that we lowered debt for our students. And those were all, that was the plan. Every one of those things was a strategically identified plan. And then we worked on policies that made those things true. And so we'd love to be able to continue those efforts here in California.
Thank you. And sounds like there were a number of your California initiatives that you brought to Ohio, and then that experience then coming back here at this time, so important. We have a couple of questions from the audience, and I want to take those, and then I want to come back to some other questions that hopefully we'll have time for before the hour ends.
Yes.
Let me take the first audience question, which said, as you noted, UC recently had a surge in freshman applications among African American and Latino students, which is very encouraging. At the same time, during COVID-19, many high school students, particularly students in underserved communities, are falling off the pathway to college by not taking the AG courses. What will UC do to ensure equitable access?
Yes, and I'm hearing a little interference, so I hope that's not, if you're not hearing it, great, I'm okay. But let me say, that's really a broad issue across California. I'm quite concerned, we mentioned K through 12, and I'm quite concerned that for young people that we're able to continue to provide a pathway, educational pathway forward, so that they are all able to make that progress appropriately. We are doing all that we can, and we've done all that we could to help create more broadband, and we're advocating for more broadband across the state to make sure that the digital divide doesn't hold people out. And then in our own admissions policies and processes, we look at the circumstances that students come from, and we use comprehensive admission, holistic admission, to try to weigh those circumstances on the students that apply to us. What we've seen is that the number of students who are applying to us who are moving forward to come to us, that number is greater than in the past. And so we're just in the process, and I'll see if there are other nuances within the applicant pool. But we have 1,000 people actually who do admissions on our campuses combined each year. And it's that many people because we want people to be able to look into the applications enough to be able to understand the circumstances of the applicant's file and to be able to make reasonable decisions based on that. And then I will say, I mentioned our work with Chancellor Oakley and with Chancellor Castro, and they as well are interested in these issues, and so we're all trying to stay cognizant of this and to keep a good pathway moving forward.
So I'm hearing a little interference too, and I just sent a note to see if we could do something about that. So as you mentioned the commitments of your colleagues in public higher education, I wonder if you, in your conversations with the governor and the legislature, you're getting a sense of their commitment
Yes.
to these issues.
let me say I want to thank the governor and the legislature for their support. We've had many conversations with them. I mentioned several times a week I have conversations about diversity and equity and inclusion. That's always on my calendar. I will say that every week I talk to someone from the legislature or the governor's office in one fashion or another, and yesterday was the most recent time. And I would say that the legislature and the governor have been very supportive of the needs of the education segment, and I think they understand that when the country finds itself in a crisis, an economic crisis like this, and a public health crisis, that the education system, the higher education system, we are the pathway toward recovery, and their investment and support of us helps us do what we can to lift up our communities and to prepare our citizens for the future. And I think that they've been quite thoughtful about this and quite supportive, and we see them as very effective partners and appreciate that.
Thank you. A couple other questions come in from the audience. One is, how can UC better support the advocacy goals and priorities of its 285,000 UC students, and on what issues of shared importance can UC students work with UC leadership to advance jointly?
I appreciate that. Let me say, I had, all these things. I was a student leader when I was in school. I had a variety of jobs and organizations, and so all of these years, I've really loved my ability to work, the privilege I've had to work with student leaders. In fact, through this year, I mean, not this academic year, but all the academic years up through last spring, I teach undergraduates, and really enjoyed that part of my favorite part of the job in many ways is to work with the new generations as they're coming along. And I'd say that we all share the same basic goals. We want access, affordability, and excellence. And the students help by sharing with me those parts of what we're doing are working well for them, and those places where we can put more attention and focus. We've created a new, actually we had a great review recently on the basic needs of students, making sure that we are doing what we could. We focused on food and shelter. But we wanted to think more broadly about transportation, broadband, other things that students need to be successful. And I think that those conversations have been quite robust and have really helped us a lot. And we're thinking a lot. I had a conversation with our graduate student leaders just a week ago about the challenges that they have had in completing their research, for instance, during the pandemic, and the flexibility that the faculty need to be able to provide to them to be able to do those things. So actually, I'll be talking with faculty leaders later on today, and we'll be able to bring those concerns of graduate students to them. And I think that we are engaged in active conversation routinely, and the success of the university is reflected in the success of its students and the success of its faculty and the success of its staff. And so my connections with students on those issues has always been central to the reason we come here every day.
Thank you. And that question, by the way, was from Aiden Arras.
Yeah, President
of the University of California Student Association. I have a question from James Crisafalli from the Coro Southern California organization. How will the COVID-19 pandemic impact the share of higher education opportunities that are offered online versus in person in the next 5 to 10 years?
I think all of us are going to have more opportunities offered online and using technology. That as we get better and better at online education, it will be a larger part of our offerings, and I hope will make us more. At my prior institution, it made us more efficient. We could actually educate more students in the same space because we could do students side by side in virtually and in person. And so I'm sure that our future will look different than our past vis-a-vis virtual education.
So here's a question from Usman Aslam, a doctor pharmacy candidate at UCSF. Are there any plans to expand services for immigrant students in addition to COVID relief, as COVID-19 has exacerbated healthcare outcomes for those in specific socioeconomic classes and those in immigration classes?
Yes, and that's been a big, very important for us at the university since the days of AB 540 and AB 540, SB 540. God, that was 10 years ago. I'm forgetting, but if I remember the 540 students. Forgive me for brain freezing on that for a second. But it's a critically important part of our enterprise, and we actually are looking at specific programs that focus on the affordability of our educational opportunities for students who are international students who are undocumented, and to make sure that we work to create a pathway for them to participate fully in our society as well. And let me say, we appreciate the work of the federal government in helping us with our advocacy for DACA students and many of the other programs that we have to support these students. Critically important to us.
Thank you. So here's another, I think, very timely question. With COVID-19 unprecedented impact on unemployment, coupled with surveys showing people are questioning the return on investment of getting a college degree, what are the UC schools doing to help underrepresented students prepare to enter a tight job market?
Yes, I think all of us are concerned about that. And what we see is that although there's been a lot of discussion about it, a college degree is still a great pathway to a quality job and a quality future, and actually better healthcare and many, many other things that help enhance one's life. And when we look at the challenge in getting a job or the challenges in unemployment, not having a high school degree is worse than having a high school degree, but a high school degree is not nearly as effective as having a college degree or an advanced degree and being able to be employed. And so we still believe that a college degree or a graduate degree or a professional degree is a great pathway to employment and a really engaged life. And we encourage that, and we're doing all we can to help students get those degrees as effectively as possible.
Thank you. So we're almost out of time, but I have a couple of questions I'd like to ask you. One is about sports and one is about music. First of all, sports. I know that you've been involved in college athletics. You've been on the NCAA board. Your thoughts about what college athletics has been like during the pandemic and what it's likely to look like in the future?
Well, college athletics, again, like all of us, has been challenged during the pandemic, and we've seen this. And a great deal of the college athletic calendar was canceled, most of it, because most of the college athletic calendar is things that are not on TV, so that people don't see them. But multiple leagues canceled their work, they're in-person activities for this year. And I think that what will happen as we have more vaccines and more safe protocols next year is that for many more students, there'll be a chance to compete in intercollegiate athletics. The NCAA has in the ballpark of 500,000 student athletes competing across the country, and to their great advantage overwhelmingly. And so I think that things that weren't safe this last year or weren't feasible this last year, those things will be safe in the future. And we'll look forward to that being another part of us getting back to the things that are so strong about the past.
So I know that you're a big music fan and a musician. You've taught courses on music. You've been on the board of the Rock and Roll Hall of Fame. Can you give us some insights into how music has been something that you have maybe called upon during this very challenging time?
I think that music as a form of art reflects the political and personal and social circumstances of the artist, and it's a way that we have to communicate, that we can communicate with each other. So I've always found that to be very valuable, and I've been thinking about that a lot. We're all spending more time with ourselves these days, than with other people. So I've been listening to a lot of music, and just in the various streamings, I've been hearing a lot of older music. And I was thinking just a little over a week ago, we lost Mary Wilson from the Supremes, who I had a chance to work with in our course. And, I thought about her story and how music was a way for her to kind of enter and change the culture of the country, and the barriers that were broken by music, and the kind of music that she and her colleagues celebrated and sang for so many years. And so I've always been a fan of that, a fan of art, and a fan of music. And I think in these days, keeping ourselves connected with other people and connected through art is an important thing. Trying to keep ourselves exercised, get exercise, and to get out around in the world is something I try to continue to do. And so I remain a fan, and again, looking forward to us being able to get together and share music that's done live with artists when that's a safe thing to do. That'll be one of the wonderful things we're able to return to.
And thank you so much for sharing that, as well as your vision and your leadership of the University of California in the hour that we've had today, which went very fast. And we've reached the end of our program. I'd like to thank you, President Drake, very much for joining me today in this conversation.
Well, I appreciate it, and really appreciate the questions that were called in, and look forward to continuing to work with you. And stay safe and have a great rest of the week.
Thank you so much. Once again, I'd like to thank the Sutton family for sponsoring today's event, and I want to thank all of you for joining us. Later today, you'll receive a survey about this event. Thank you. Please be safe and have a good afternoon.